This video is made possible by our loyal Patreon supporters. Visit patreon.com/psychetruth.
Hello, welcome. Today I'm going to be working on the lovely Julia, and we're going to be doing a full neck massage as per request from her. So I'm going to go ahead and get started. And I'm actually going to start without any oil. So always just going in nice and slow and gently, and just to kind of help Julia ground into the experience a little more. I'm not going to really move her head around very much. Just gonna kind of let her sink into the table a little bit and relax. So she was saying that she's having some discomfort on her right side, like up a little bit higher. So that's kind of a sign to me that I really would like to work on the connective tissue along the mastoid process, so it can kind of bring a really nice release into that SEM and into the occipitals a little bit. So without moving her head too much, I'm just gonna apply some pressure and start doing some fascial work. Whenever you're working with the connective tissue, you want to make sure that you are able to create plenty of traction. So just making sure that I have a nice firm hold. And not really taking a whole lot of time here. But I'm going to go ahead and work my way around the ear and just working these little muscles. I'm always kind of thinking when somebody comes in with a complaint, I'm kind of trying to figure out if it's referral pain, which it often is. And then I'll kind of just think broadly how I can work broadly to help that area feel better. So I'm just really encouraging more relaxation in the temple and the jaw, put less pressure on that area along the neck. And once I kind of feel like my client's a little more settled, I will start to focus in a little bit more. And just always when I'm doing this kind of neck work, always making sure that my client's head is stable by supporting with my opposite hand. I don't really find that it's not healthy to try and go super deep into the mastoid process generally. But as I start moving into the occipital muscles, I'm starting to increase my pressure a little more. And you can definitely use your knuckles here. It feels really good on the wrist, but I don't really feel, I've never felt that comfortable doing it that way. So I'll usually just kind of angle my chair as much as I need to straighten out my wrist. I can use my finger pads or my thumb. And I just find doing little circles, it's a nice distraction and just a nice way to work in here. Sometimes when the upper trap is really tight, it can pull on all these neck muscles. So that would be kind of something that I would usually think about if somebody has discomfort here. And what can happen if you don't think broadly when you're working with clients, and especially if you have a history with them. Sometimes if you just work on an area that's feeling the pain, like you don't make as much progress as you could if you think broadly and kind of think more about the root of why it might be happening. Especially when it comes to like chronic, issues that people have had for a long time. And I think I'll revisit this area. I'm going to grab some oil. And if my client's head is turned when I take my hands away, just make sure that they're comfortable before I And I want to feel like I can get a nice firm grip, but I want to be able to glide across the muscles as well. So just kind of using lighter on the oil today. And I'm just going to start to scoop that upper trap into my fingers a little bit. And I really like doing a pincer grasp in here just to increase circulation, get everything moving a little bit more. It's a great thing to do in combination with more lengthening techniques. Kind of flushing everything out. And you want to feel like every body is different. So you just want to kind of let your client's body take the lead and just follow the lines as they occur. And actually doing a little bit of work on the fascia and the soft tissue at the same time. So I have enough traction where I can get that that grip that I want. it's a really good sign when you, a sign that you're really making progress with the fascia is if the skin starts to warm up and if you get some color, but you don't want your client to feel like they have a rug burn, so you just kind of have to use your discretion. And I'm going to start working my way in to this SEM. And sometimes if it's really tight, it can feel kind of hard to pin down. So just, I find that just starting a little bit lighter really helps. I really like doing trigger point in here, but it's a really sensitive area, so you just need to communicate with your client and make sure that they feel comfortable. And one thing that I don't like when I get massages is when things feel kind of choppy, especially when I'm getting trigger point and it's just kind of, I feel like someone's poking me. So I really try to keep a nice flow going, even when I'm doing trigger point work. And I want the whole muscle to feel more whole, more connected. And at the same time, like you know, don't worry about being perfect because no one's perfect. So and sometimes to get a better angle for the scalene muscles, you might need to turn the head in a little bit more. And there's just all kinds of cool ways that you can get the right amount of tautness in the muscle that you're helping. And scalenes are another area where you need to start nice and gentle. I like to reverse the process when I am about to wrap up one side. And I'm gonna do a little bit more work in here. If I'm having trouble, if I feel like my client could use some more pressure, I'll usually go in with my thumb. And again, just kind of ending with something that's nice and broad and a little bit less focused. The most challenging part when there's, quite a bit involved with that sequence. So sometimes the hardest part is just remembering what I did. I'm spending more time on an area. And just, more gently working on that mastoid process. And that can bring a really nice release into the SEM without having to work on it directly. And it's crazy how much tension we can store in our temples without even realizing it. And always, if you're starting to notice your client kind of shy away from your touch, like it's a good time to check in and just make sure that the pressure you're using is good. And starting to go in with a more detailed work. And I just want to take a minute to thank a few of our patrons. I'd like to thank Mark Hem, Colin Hunter, and James B. Thank you guys so much for your support. So I could do this work along occipital ridge with my client face down, but it would be a lot harder. So just because you can doesn't mean that you should. Always just choosing the technique that will allow me to be most effective and also conserve my energy. And also just kind of feeling around for any swelling. And if there is a lot of swelling, you never want to do deep tissue. And I'm going to go in with my oil. Don't be afraid if you're having trouble finding, like, working on a muscle. Don't be afraid to move the head around. Just, I'd say, do so slowly so that your client feels like they can relax even if you're moving something around. And yeah, I'm just focusing on stretching that connective tissue a little bit and working the soft tissue. Nice broad strokes. this is really nice because with the head turned like this, I already have some tautness in this area. So it's a great way, it's a great position to do some fascial work. And I would say neck work requires probably like the most concentration of any body part. So, which can be fun, but it can also be kind of mentally demanding. So if I need to, I'll kind of take a little just moment when I'm doing a broader stroke. I might just take a few deep breaths and kind of reset mentally if I'm starting to feel kind of fatigued, especially if I'm on my 4th or 5th client of the day, kind of practicing those little self-care things, whatever tools. And I am going to work my way from the upper trap into these different neck muscles. Just flushing these muscles with blood and lengthening, flushing everything out. And just a little word of advice, if you feel like you're starting to go in for deep tissue and you're feeling like you're feeling a little bit choppy in your movement, you probably need to apply a little bit more oil. But because I'm focused on working on the connective tissue a little bit more, I'm using less. And just starting to work my way in to the SEM, paying attention to Julia's body language. If her shoulders start to lift, it might be a sign that I need to adjust my pressure or communicate. It's the worst when you're getting a massage and it's just absolute silence and no communication. So just as the therapist, always making an effort to keep communication open, but not demanding it. And starting with some trigger point. Especially as I go in with this trigger point, I might need to make up, an adjustment or two, just depending on how everything feels. Important to not forget about the scalene muscles. And I like to do a nice broad stroke all the way into and past the occipital ridge. You can use a soft fist here if you want. It can feel really nice. I usually use the pads on my fingers to just like the sensitivity that I have, and it feels really natural to me. Just really encouraging those shoulders to relax away from the ears. This reminds me of a cat for some reason. And when I'm working on the neck, I like to just leave my client feeling how everything's connected. I like to end with both sides. And if I have a client who is in a lot of physical pain and I can't turn their neck, I'll do a lot of this kind of work. And it just feels like Julia could use a nice, slow, stroke along her upper trap. Feels like there's some tightness there. Depending on my client, I'll use different techniques. If I'm working on someone who's really fidgety or who just typically moves really fast, I'll kind of adjust my massage a little bit. I really like this move, this traction for the cervical spine. You want to be fairly gentle but firm. And I'm going to end with some less focused, just feel good scalp. Always a nice way to end a more intensive neck session. And always when I'm doing scalp, making sure that I can rest my wrists on the table. So if my hands are floating, this is significantly harder. And you know, anything that you do on the scalp usually feels really nice, so you don't have to overthink it. It's amazing just what, you know, mindfulness can do for a massage when you're mindful in your movements, you're present. If I want to be a little like extra nurturing, this is a move that I really like. Just kind of cupping the ears and dragging my hands up. There's just something about this that feels so nice. I like to end with dragging my fingers across the hairline along that frontalis muscle. Just helps relieve so much tension. Forehead, the temples. And just ending nice and slowly, taking my hands away, never rushing. And that is all for today. Thank you for joining us today, guys. I hope that you enjoyed today's video, and we look forward to seeing you next time.